All right, let's break down blood coagulation modifiers. If you're a nursing student, you know these are absolutely crucial for your exams and, more importantly, for patient safety. We're going to cover exactly what you need to know. So let's start with the one question you should ask about this entire class of drugs. What makes every single one of them a high-alert medication?
The answer is simple. They're all considered high-alert medications, or HAMs. That means even a tiny mistake can cause major harm to your patient. With these drugs, you have to be incredibly careful.
Okay, let's dive into our first class to see how this plays out in the real world, starting with the anticoagulants.
Here we have the two big ones, heparin and warfarin. Now, their job isn't to break up clots that are already there. Instead, they work to prevent new fibrin clots from forming in the first place. That's why we use them for things like DVT, PE, and after a heart attack. Now, for your nursing brain, this is what you need to lock in. First, doses can be all over the place, so you always double-check. Second, for heparin, you are constantly monitoring the APTT. And third, the number one risk is bleeding, so you have to be on high alert, especially with your older patients.
And here's that magic number for heparin. The therapeutic goal is an APTT that's 1.5 to 2 times the normal value. I guarantee you'll see this on an exam. Burn this number into your memory.
Next up, let's talk about antiplatelets. We're going to focus on one of the most common drugs out there, aspirin. So aspirin works differently. It basically makes platelets less sticky, so they can't clump together to form a clot. And get this? The effective one dose lasts for the entire life of the platelet, which is about 7 to 10 days. We use it to prevent heart attacks and strokes. And in an emergency, having the patient chew an aspirin is a key move for acute coronary syndrome. So what are your key nursing takeaways? Well, because of that 7 to 10 day effect, patients have to stop taking aspirin before any surgery to prevent bleeding. And this is a massive safety alert. You never give aspirin to a child who has a viral illness because it can lead to a really dangerous condition called Ray's syndrome.
All right, on to our third category, the thrombolytics. I want you to think of these as the clot busters. These are for serious emergencies only.
Our main example here is alteplase. Now, unlike the anticoagulants that prevent clots, thrombolytics go on the attack. They actively dissolve clots that have already formed by turning plasminogen into plasmin, which is the body's natural clot-dissolving enzyme. This is why we use them for life-or-death situations, like an acute ischemic stroke or major heart attack.
The nursing rules here are non-negotiable. First, because the bleeding risk is so high, you avoid all IM injections. You're going to be doing intense, frequent monitoring for any sign of bleeding. And most important of all, you must have a CT head scan done before giving this drug to make sure the stroke is ischemic, not a brain bleed. Okay, we've covered how these drugs work, but what do you do when you need to turn them off in an emergency? That brings us to our last and absolutely vital section, knowing the reversal agents.
This is pure memorization, perfect for your flashcards and crucial for safe practice. For warfarin, the antidote is vitamin K. For heparin, it's protamine sulfate. But it's just as important to know which ones don't have a direct antidote. For aspirin and alteplase, there's no magic reversal pill, which makes your nursing assessment and monitoring skills even more critical.
So let's pull it all together. This view really helps you see the big picture. We've got anticoagulants, which prevent clots from forming. We've got antiplatelets, which stop platelets from getting sticky. And we have thrombolytics, which bust up the clots that are already there. Seeing them all together really helps connect the dots. In the end, it really all comes down to this. Every single thing you do with these medications is guided by the nursing process. You assess the patient, you monitor them closely, and you intervene when you need to. Because with high-alert drugs, your number one priority is and will always be patient safety.